Hello friends, we are going to revise ECG. Okay, first is the idioventricular rhythm. It is very slow heart rate, less than 40 per minute. Pacemaker is the Purkinje system, that's why heart rate is very slow. Cause of idioventricular rhythm is digitoxin toxicity, anesthetic agents and cocaine. Next one, so we see this ECG and we see there is the S wave prominent in V1 and V5 or V6 there is prominent R wave. Addition of both is more than 35 mm. That indicates left ventricular hypertrophy, and ST depression is also noted on these leads. Okay, with T wave inversion, ST with T wave inversion. Okay, next one, single chamber pacemaker has to be placed in right atrium or right ventricular. Dual chamber pacemaker has to be in both right atrium plus right ventricular. There is triple chamber also, that is accept उसमें आता है, तो left atrium should not be there. Okay, ये याद रखना है. Now next one, this ECG, we see in this ECG there is a progressive increase of PR interval and sudden drop. So this is the Wenke-Bach heart block or Mobitz type 1 or Wenke-Bach block. It can be seen normally in athlete at rest, that is due to increased vagal tone and acute inferior wall MI. Beta blocker toxicity, calcium channel blocker, digitoxin toxicity. Next one, we see this ECG and here we see prolonged PR interval is more than 5 box, यहाँ पे देख रहे हैं. So एक निमोनिक है PR interval. How we can remember the interval? PR is the प्यार हिंदी में, तो प्यार रात के 12 से 2 बजे के बीच में, ठीक है ना, 12 से 2. So 12.12 to 2.2 सेकेंड, यह सेकेंड है. कुर्सी शुड बी द नंबर 1.1 सेकेंड. QT इट कट के 3 हो गया क्या, 4. सो 0.43 सेकेंड. Next one, here we see slurring up stroke of R wave and QRS is white. When QRS is white, automatically PR interval will be short. So this is the delta wave present in WPW syndrome. Patient can be asymptomatic and symptomatic. Symptomatic patient has to be treated first with vagal maneuver, adenosine, verapamil, beta blocker. Initial treatment है यह, but definite treatment should be catheter ablation. Next one, we see this fast heart rate. This is a ventricular fibrillation. QRS complex यहाँ कोई दिख नहीं रहा है. This is a ventricular fibrillation. तो treatment is the shock. Defibrillation will be the shock, treatment of choice. Next one, lateral wall MI, lateral wall cardiac MI. यह कौन सा लीड में दिखेगा, 1 AVL 5 and 6, 5th and 6th. Next one, QT prolongation. QT prolongation can be is anti-arrhythmic drugs causing QT prolongation. Class 1A and 3. So mnemonic is deep sac is the mnemonic. Bad mnemonic, that's okay. The D is dofetilide, I is ibutylite, P is prokinamide, S is sotalol, A is amiodarone, Q is quinidine. Next one, normal QT value it is between 350 to 450 millisecond. In male more than 440 millisecond, we can say QT is prolonged. In female more than 450. So symptom is syncope or cardiac arrest. So person has to be, patient को क्या देना है, 2 mg of magnesium sulfate IV stat and remove the causative drugs. ठीक है. S wave, next one, S1 sound of heart correlate with QRS of ECG. S2 sound correlate with int of T wave in ECG. V of JVP correlate with increased atrial pressure before tricuspid valve opens. Okay, next one. Here we see in lead 1, P wave is inverted, QRS is inverted, and the chest lead from V1 to V6 there is the reverse pattern. Okay, reverse pattern. So maximum R wave we can see that is in V1 very small, but is still among V1 to V6 this is the maximum. There is almost no wave R wave in V5 and V6. So this is the reversal of R wave in chest lead. So this is the condition in dextrocardia. Next one, left bundle branch block versus right bundle branch block. So how we can remember? Suppose ये कोई सड़क है, हम we are following left always. Okay, आगे कोई ब्लॉक हो गया, so left bundle branch, what we do, हम यहाँ नीचे उतरते हैं फिर ऐसे ऊपर चले जाते हैं. So उतार एंड चढ़ाव ऐसे याद रखेंगे. So V1 हमेशा बंडल ब्रांच ब्लॉक में V1 V6 देखते हैं. So उतार मतलब V1 में समथिंग एस वेव बहुत ही ज़्यादा प्रोमिनेंट होगी, मतलब नीचे गड्ढा. ठीक है. एंड चढ़ाव इस V6 में हम अप स्ट्रोक देखेंगे, यह देखेंगे, दैट इज R डैश पैटर्न. ओके, नाउ इन राइट बंडल ब्रांच ब्लॉक V1 एंड V6, V1 में हम क्या देख रहे हैं, स्मॉल R डिफ्लेक्शन, प्रोमिनेंट S एंड R डैश. ओके, सो रैबिट ईयर ऐसे होता है, छोटा कान एक बड़ा कान. एक्चुअली वैसे दोनों कान बराबर होते हैं रैबिट में, बट वी याद करने के लिए ऐसे याद कर सकते हैं. ओके, 2 कान खड़े. ओके, M. और V6 में क्या है, Q वेव इज़ वेरी स्मॉल. V1 में R वेव बहुत ही स्मॉल है, जबकि V6 में Q बहुत ही छोटा है. ओके, देन प्रोमिनेंट R, देन अगेन S, small s. Maximum R wave is seen in V4. Next one, we see this heart rate. This heart rate is very fast, and transesophageal echocardiography shows thrombus in left atrium. So condition समझ में आ गया, A5 का condition है atrial fibrillation. So atrial fibrillation में थ्रोम्बस फॉर्मेशन होता है. So हमको क्या देना पड़ेगा, पेशेंट शुड रिसीव एंटीकोगुलेंट. दिस वन इज द लास्ट पॉइंट टुडे. वी सी हाइपर एक्यूट टी वेव, हाइपर टॉल टेंटेड टी वेव, जैसे कि टेंट की तरह ऐसे हैं, टेंट की तरह है, टॉल टेंटेड टी वेव. And patient has potassium level is elevated more than 5.5 millicurie per liter. This is the hyperkalemia. So thank you very much, friends.